Hey, Margie here. How often do you feel that your neck is tight and your shoulders are tight? But did you realize that this tightness in the muscles can actually increase the stress you're experiencing? And the stress, unfortunately, has negative effects on our bones and overall health. Well, today we're going to learn some techniques we can use to reduce that muscle tension, and that will in turn reduce our stress. And our special guest is Chantal Donnelly, who's a physical therapist and the author of the Amazon bestselling book, Settled: How to Find Calm in a Stress-Inducing World. And Chantal is going to explain this connection and show us some great, easy techniques we can put into our everyday life. That's going to really make a big difference. So I'm so excited to share these with you, and stay tuned. Welcome, Chantal. I'm so happy to have you here on the podcast. I absolutely love what you're going to talk about. And I feel as a physical therapist, your message resonates so much with me. When I first saw your work and saw what you were doing, I was like, oh my gosh, it was very similar to my experience. So I'm just really excited because I think we're bringing a different piece to the equation that, from a physical therapy lens. So welcome.
Thank you. Thank you so much, Margie. I have done a couple of podcasts lately, and you are the first physical therapist that I am talking to. So I'm really excited. You and I can geek out on all of the physical therapy stuff.
It's so true because we really do have a different training. We really do look at people differently in terms of their body. And I love the part where you have the mind-body connection. And a lot of people know that, but when we start out as body workers and people really working so intimately with the muscles and the joints, and so this is so great. So why don't we start there? I always love to hear the backstory. How did you, as a physical therapist, get involved in stress management and see that it was such a big part of everything you did?
Yeah. Well, I had been practicing for, I don't know, at that point, it was like 15, 18 years. I had a private practice, mostly seeing orthopedic patients, outpatient. And I loved what I was doing. I had done a couple of rehabilitation videos. One's called Strong Knees that Guyam had picked up. And then I had another one called Pain Free at Work. And that went well. And I had my private practice. And I was finding that I was helping patients, but there's always that but. I would say over 80% of my patients were getting better on my table. And then they would go off into their stressful life, whether it was, a relationship strain or, a toxic boss at work, or, maybe they had a sick parent or a sick child or whatever stressor, financial insecurity. It didn't matter what it was, some kind of chronic stressor. And what I found is that I could unwind their connective tissue on my table and make them feel better, but life would wind that connective tissue back up. And it was a missing link for me. And I really felt like if I'm going to really, truly help my patients, I've got more than half of them who are really being affected by this stress piece. And I need to learn more about stress. And of course, at the same time, I was personally going through a whole lot of stress, which was manifesting in my body as insomnia and a disconnect with my son, who was about to go into middle school, and arguments with my husband, neck pain, headaches. I had all the stress symptoms myself. And so I was like, if I'm going to help myself and my patients, I need to figure this stress thing out. So I thought, kind of going back to what you were saying earlier, like I thought I was going to have to go in and get a PhD in psychology. Like I thought, oh, I am just going to have to change careers here. And I was willing to do it. I was ready to get back to school. And what I realized as I started doing a deep dive into the science of stress is that my physical therapy background, my anatomy knowledge, and my physiology understanding was the perfect foundation for managing stress. Stress really starts in the body. And yes, it's partly mind-based, but there is such a two-way communication between the mind and the body. And a lot of times when we're under a lot of stress, we try to use our mind, right? Like we use positive thinking, we use maybe we see a psychologist, we meditate, all of those things. And a lot of times that doesn't work for people, not initially, because they're in such a high stress overload that their cognitive abilities and their rational abilities are kind of offline a little bit, right? And the body is giving so many uncomfortable sensations that they're trying to tell themselves, no, those sensations don't exist. Those sensations don't exist. You're lying to yourself, and it doesn't work. And really what I found is that my physical therapy was a great starting point for helping myself and helping my patients.
It's so interesting because I had a similar story working as a physical therapist in outpatient chronic pain. I was working with back pain, neck pain, and I had gone through a bad situation myself. And people are like, oh, you're so happy and this and that. And so I just said, what the heck? What got me through this? I started teaching them what I call happiness habits, but a lot of it also was stress, different techniques as well. And they got so much better than they just did with conventional physical therapy. It was unbelievable. So I know that you've seen that too with chronic pain, in that there's a correlation with chronic stress and chronic pain.
Oh, yeah, for sure. I mean, the thing about chronic pain and chronic stress both is that they are your body's adaptive way of protecting you, both of them, right? Like you go into a stress response, that is your body's way of saying there's an emergency at hand and we need to deal with it. You have pain, that's your body's way of saying, don't move that part of your body and let's bring in the white blood cells and the immune system can kick in and start to heal. So, in that way, they're very similar. They're also very similar in that we can get stuck there, right? And that's basically the definition of chronic pain, is that your tissues have healed, but your brain is still telling you that there is pain, right? And with chronic stress, the stress may have dissipated, but you're still in survival mode. It's like the analogy that is used in orthopedic settings for chronic pain, right, is that there's a broken alarm system. It's sort of like your home alarm system has gone haywire and you can't turn it off, right? But we use the same analogy for stress. When you're in chronic stress, your alarm system has become overly sensitive and won't turn off, right? And I usually say, like, if you have a home alarm system and a squirrel runs across your roof and that sets off the alarm and the fire department shows up, you've got a problem with your alarm system, not with a fire. And that's a lot like what chronic pain and chronic stress both are. Another interesting similarity between the two is that it generally has to do with your past experiences. So when we are stuck in chronic stress, it has to do with something that happened in your past. And it doesn't even have to be to you. It can be to your mother or your grandmother or your father or grandfather, right? We now know that stress can be genetically passed down. And so it's what happened in your past is how the brain predicts what's going on with you. And that is generally why people get stuck in a high stress response. Well, with chronic pain, it's about a past injury. And there's a little bit of confusion between the body and the brain as to the fact that this injury is now healed. But the brain keeps thinking about, oh, well, there was an injury in the past, so we're still sending that pain message, right?
Yeah, it's so interesting because it can affect every aspect of your life. And so many of the people listening are trying to take care of their bones. And your exercise program is and your whole life, when your neck is tight and when you have, tight muscles and everything's contracted, your mood changes, your posture changes. It really has a negative ripple effect into everything. So it's just such a win-win situation. And I know some of the tips that you teach have to do with actually doing techniques to the muscles. So a little different than, just visualizing and all of the mind techniques. We're actually doing body techniques that are going to break this cycle and help people. So you want to just talk about neck pain and the tight muscles? Your book is great. And you go into this in detail, which I think is so helpful to people because it's not something, right now, oh my gosh, people are on their computers so often. And I think this problem has just increased exponentially over the years. So it's affects all ages, not just people with bone issues. This is something I think even more the younger generation, because they started on the computers so much younger than we did.
Oh, yeah, definitely. Yeah, we're definitely seeing an increase in neck pain and we're seeing an increase in stress. And lo and behold, those two things are indeed correlated. And I'm going to talk about neck pain, but really what I'm talking about is stress in general. So if your listeners don't have neck pain per se, they're still going to get a lot out of this little primer that I'm going to give you on how neck pain and stress are related. They did a meta-analysis, and for your listeners, that means that they took a group of studies and made sure that all of those studies met a certain criteria, meaning they were peer-reviewed and they had a control group and that kind of thing. And they take all of these studies and they synthesize all of the studies together into a summary. So they did a meta-analysis on neck pain and stress, and they looked at 28 different studies. Over the whole of those studies, there was probably 40,000 subjects involved in all 28 of those studies together. And they looked to see if indeed stress gave you an increased risk of neck pain or arm pain associated with neck problems. And they found that indeed, absolutely, there is an association between neck pain and stress. So I find it really fascinating, and I'm excited I get to geek out with another physical therapist about why is neck pain so related to being under stress? Why is it that when you are under a chronic stress survival mode, if you want to call it that you have an increased risk of having neck pain? And you had talked about that constriction, right? So we can get into that for sure, because that's part of one of the reasons. So why are they related? The first reason is that when we are stressed, we chest breathe versus belly breathing or diaphragmatic breathing. And what we know about chest breathing is that it activates the sympathetic nervous system. So for your listeners, we're kind of going back to biology 101 here. Your sympathetic nervous system, you guys probably already know this already, but it's your fight flight nervous system, right? So when you chest breathe, you are actually putting yourself into more of a fight flight nervous system situation, right? So it's sort of a negative feedback loop. You chest breathe because you are stressed, and because you're chest breathing, you are having more stress. So we need to break that loop. And later on, I'm going to talk about tools and what we can do to break that particular loop. The other interesting thing about when we chest breathe, and you've probably seen this with your patients, when you ask someone to take an inhale, you'll sometimes see the shoulders go up towards the ears, right? And what they're doing is they're activating their scalene muscles. So for the listeners, scalene muscles are muscles on either side of your neck. They're kind of in the throat area. They go from your spine and then they attach to your first ribs. And people are always really confused about the first ribs. The first ribs go above the collarbones, which most people don't realize they come up that high, but that's where these muscles attach to, just the first rib right above the collarbone. So the scalene muscles, Margie, if you remember, I'm sure you remember this from your anatomy class, those are called accessory breathing muscles. They help to turn the neck. That's what they're designed to do. But they're also accessory breathing muscles. Why do they call them accessory? Because you only use them for breathing when you are in fight or flight, when you need that extra oxygen to run or to fight. What happens is that a lot of us, because of the way our modern life is designed, we're always rushing. We're always facing a whole lot of stress. Hello, pandemic. Right? There are so many reasons why we are under stress. And that means that you're going to overactivate your scalenes. So now your brain doesn't know to turn off the stress response because your scalenes are on, and it gets a little confused. Like, why are these accessory breathing muscles now active? And that's part of why we stay in that chest breathing pattern when we're under a whole lot of stress. So when we get to the tools, we'll talk about what we can do about relaxing those scalenes.
I just want to say one thing about that. For a couple of years, and I don't even know if my audience knows this, I worked with dentists on and TMJ. So I worked with all sorts of head and neck surgeons and all sorts of people. So saw lots and lots of, and the majority had exactly what you said, overactive scalenes, as well as other accessory muscles. And I think also in our world, we want to give things our best shot. So we really put extra effort into it. So we don't even realize we're tensing way more muscles than we need to. And we're so fatigued at the end of the day because of it. So I think that's such a good point that you bring up. And most people have no clue that they're even doing this. So yes, so continue.
Yeah, no, exactly. I 100% agree. And that whole wanting to give your best, at least for me, I have a hearing problem. I wear hearing aids. And so that adds to this. But I think because we're so heady as human beings, we really prioritize our brain. We tend to jut our head forward in order to give our best. And again, with me and my hearing, I'm always kind of jutting my head forward. So that's where a lot of my neck problems were coming up. And when I was under stress, the inflammation from the stress was really sort of upticking that neck problem and the posture problem. But yeah, we really are sort of top heavy, right? Like we really jut ourselves forward to sort of be engaged with people and give our best. And that hurried piece too, we're always running around trying to give our best as fast as possible because we're always in such a rush. And that seems to sort of jut that head forward as well. So those are all ways in which the stress piece comes into play as well. So posture, right? So when you jut your head forward, you can do it. Usually people are doing it when they are slouched. And I know with osteoporosis, there's that tendency to be fairly kyphotic, fairly rounded in the thoracic spine. What happens is that when you are slouching, in order for you to see what's going on in front of you in that slouched posture, you actually have to lift your chin up quite a bit. Otherwise, you're looking down at the floor, right? And so what I always have patients do to get a sense of what that's doing to your neck is if you keep your head in that posture where your chin is jutted forward and you straighten up your posture, but leave your head where it is, it's like you're looking at the ceiling all day long. So you can imagine how much strain that is on the neck if you're looking at the ceiling all day long. And so that's why this forward head posture and this slouching posture is going to be really hard on the neck.
It's so interesting. Yeah. It also, so again, when I was working with TMJ, oh my gosh, first of all, everybody had the forward head posture. But the other thing that happened was that people had terrible headaches. There's so many nerves that come through there that, it was amazing that so if anyone listening has headaches, this can really help because that's the source of just a tremendous amount of headaches when you're in that forward head posture.
Right, exactly. Yeah. And that posture also, whether you've got the forward head or you're just slouching, and again, those two usually go together. The problem with the slouching also is that it closes down the rib cage and compresses the diaphragm. And so later we're going to talk about how important breathing is for decreasing stress. And I think most people already know that. But when you are slouched, your rib cage can't open up as well. Excuse me. And your diaphragm can't drop as well. And those are the two things that you need to do to be able to breathe properly. So you end up chest breathing, right? So we're back into that loop of you've now got yourself chest breathing because your rib cage can't move in a slouch posture, and now you're in fight or flight.
So before we go into the techniques, I just thought it would be helpful. Why don't you just share a little why stress has such negative effects on the bones?
So there's some studies that show that cortisol, which is sort of known as the stress hormone, it's also a hormone for your sleep-wake cycle. So it's not just for stress, but generally the more stressed you are, the more cortisol you have, or you have very sensitive cortisol receptors. So cortisol can have a detrimental effect on bone density. And so the more stressed you are, the more problems you have with your bones. So if women are in menopause, when you have a decrease in your sex hormones, you have a natural increase in cortisol. And that's where a lot of women will start to see bone density problems. And that's why it's the cortisol. So stress, even before menopause, if you've got too much cortisol swimming around in your body, you're going to have that affect the bones. There's also another study that came out, and I hesitate talking about it just because it's a new study and it hasn't been replicated yet. But there's some talk about the bones releasing, I believe it is, I'm going to have to look this, osteocalcin in a stress response. And that's apparently, the bones do that to actually trigger the parasympathetic response, the calming response. So your bones help you to calm your nervous system as well. So having problems with your bones, density problems with the bones and osteoporosis can be possibly, and again, this is all new research, and I'm just postulating here based on that research. It's possible that you have a harder time going into relaxation mode if you have osteoporosis.
It's so interesting because people always are so worried. Are they eating the right foods? Are they doing the right exercises? And they really want to take care of their bones. People, it's scary and they want to do everything they can. But guess what that does? That jacks up cortisol. So it's such a negative. I always say this piece, you can't forget this piece, because it usually, when people are figuring out their plan, it's totally at the bottom. Okay, I'm going to exercise. I'm going to figure out, what I need to do, if I need to have supplements, if I need medication. They're trying to figure out their plan.
Yeah.
But reducing their stress or figuring out techniques is low. It's never, oh, yes, and I have to do this. So I think I constantly remind people, and I'm so glad you're here, to get that message across that we have to deal with this. Because besides animal research, they've shown it reduces the osteoblast, the bone building cells. There's now actual clinical research, as well as increases the osteoclast, the cells that break down bone. So this is a serious issue of extreme importance. And the good news, it's such a win-win, right? Because when we do this, our chronic pain goes away, we feel better, we're happy, our posture's better. It's just starts this positive feedback loop. So I just love this. And I just love how you really wrote about it in your book and gave us some different techniques than a lot of the typical ones that we're accustomed to. So all good stuff.
Yeah. And to your point, I mean, the intensity with which they're really trying to help themselves, the intensity with which they attack exercise and diet to try to make themselves feel better, and other self-care techniques too. I see people get so intense, even socializing. I see people get so over the top with the way that they're socializing and having people over, and the stress that they put themselves under. In my book, I talk about, I don't know if you've gotten to the exercise chapter yet, but I talk about when exercise can sort of tip to that, from helpful to harmful phase, where we're actually doing too much and what to do about that. And I also talk about what you can do if you don't feel like you can exercise in the traditional sense, but still want to help your bones and your cardiovascular system and all the other systems in your body, and what you can do if you can't, take a yoga class or weight training or whatever. And the same thing with stretching. There's a whole lot of overstretching going on. And I usually tell people to back off the stretching, because if you feel that sort of panicky feeling when you're stretching, like it's a little too uncomfortable, you've activated a stress response. And so now you've activated cortisol, and that's the opposite of what you're trying to do.
Such a good point, because so often I'll see people come to me or they'll tell me, oh, I got this diagnosis and I know I have to exercise and I'm on that treadmill, and it's purely negativity, or they're doing so much that they actually have increased cortisol.
Yeah.
So as you said, do you want to just share maybe one reason why people, how people will know if they're doing too much?
Well, there are signs of exercise burnout. And that's for people who are the fitness fanatics and just doing too much. And I talk about those signs in my book. One of them is, complete utter fatigue an hour or two after you work out, having more colds more often, getting injured while you're working out more frequently. Those types of things are signs of burnout. What I find with people who are under a whole lot of stress, who then try to take up exercise and go into it in too intensive a way, what we have to remember is that exercise is a stressor. And I know that sounds very counterintuitive, but it's a controlled short-term stressor. So it actually trains you to be able to deal with bigger stresses, more long-term uncontrollable stresses. That's one of the ways in which exercise helps us with stress, is that we're teaching the body that we can handle stress by going into it in short little bursts. But your brain only knows that you're releasing adrenaline and cortisol when you exercise. So it doesn't know the difference between you exercising and you having an argument with your boss about a deadline. Like it can't tell the difference, right? So if you are, whether it's over exercising and not giving yourself enough breaks so that your body doesn't understand that this is a training ground for stress versus stress, or you're already overly saturated with adrenaline and cortisol going into an exercise routine, your body can get really confused. And those are the people I find who keep telling themselves, I'm going to go to the gym. I promised myself I'm going to go to the gym. I bought the membership, and they don't go, and they start beating themselves up. Hello, more stress because you're beating yourself up. And there's that shame spiral I feel terrible for them, because really they just need to back it up a little bit. Their body is just confusing exercise with the stressors that they're trying to run away from.
Yeah, that's really important.
I think, a sensitivity to stress can easily translate into a sensitivity to exercise. And so I think it really helps people get them out of that shame and blaming themselves. And like I said, in the chapter, I teach you ways in which you can make exercise your friend. There's lots of ways you can get benefits from movement without it having to be really super fancy or intense. And then you can slowly, incrementally add to your exercise intensity so your body gets used to it in a more appropriate way that's more compassionate and works better for your nervous system, quite honestly.
In your book, and I like the title, Settled. It's just a calming title. But in your book, you go through a whole step 1, step 2. So it's very methodical. You don't just do this. But why don't you share, since this is a podcast and people can, go into your book to really get all the details. Why don't you share a few things? I love giving something that people could put into their life right away and notice that, oh, hey, because that's what, there's so many things that you share that you can do. But I would love you to, why don't you just go through some of the ones that you found to be most effective for people?
Sure. I'm sure all of your listeners have heard about the vagus nerve. And yes, the vagus nerve is a part of your vagus nerve. The ventral branch of your vagus nerve is your calming nervous system. What we don't talk about a lot, and what I think is really cool for physical therapy, from that physical therapy lens, is that the vagus nerve is 75% of our calming nervous system. The other 25% of our calming nervous system are 4 other cranial nerves. In the book, I call it vagus and the quartet, like they're a band and the quartet's the backup singers, right? So those 4 other cranial nerves, so the vagus is a cranial nerve, which means it starts in the brainstem, and the vagus feeds all sorts of organs throughout most of the body. But these other 4 cranial nerves feed the face and the neck. So one of them, going back to our neck pain discussion, one of them feeds 2 neck muscles called your sternocleidomastoid, SCM for short, and your trapezius muscle. And the trapezius muscle has 3 parts, but mostly we think of the upper traps, right? Those upper shoulder muscles that get so tight when we're stressed. And the sternocleidomastoid is, if you turn your head, it's that muscle that pops out. It starts right behind your ear, And it's got two branches, but the main branch goes down to your collarbone, kind of right near your throat. So those two muscles are gateways to your calming nervous system, to that vagus nerve, because they all kind of work together. All of these cranial nerves work together with the vagus. And so you can massage your sternocleidomastoid. So you're going to be not only helping your neck pain here, but you're going to also be calming your nervous system. So if you go right behind your ear and you see that band coming down, basically, even if you're not exactly on the muscle, you're still going to have some benefits from this. So you just take your hands and you rake down towards your collarbone, towards that side of the collarbone that's closest to your throat. And what you're doing there is you're releasing the sternocleidomastoid and you're telling cranial nerve 11, which feeds that muscle, to talk to cranial nerve 10, which is your vagus nerve. So it's just this portal, this opening that we have, a way of talking to our calming nervous system and saying, everything's okay, we're calming this muscle down, we're releasing this muscle. And at the same time, you're dealing with your neck pain. Again, those two things work together, right? So if you can calm your neck pain down, you can calm your nervous system down. If you can calm your nervous system down, you can calm your neck pain down. Both ways.
So do you have people also, I think it will give people a sense that, because people don't have any idea that it's tight or it's shortened or it's, and so I think at doing the massage, you'll feel the difference, whether it's, it's tight and holding or is it relaxed, and they'll start. I think most people, I think that's also one of the issues. We're so busy in our heads, we don't have an awareness, oh, is my sternocleidomastoid tight?
Right. Yeah, no, and that's pretty normal. A lot of people really dissociate from their bodies. And that's a lot of what I talk about in the first part of the book, is finding what scientists call your interoception, what I call your soul speak. What is your body telling you is going on? Is that sternocleidomastoid tight? And you may not be able to know if it's your sternocleidomastoid or other neck muscles, and that doesn't really matter so much. But if you know that these neck muscles are associated with your calming nervous system, and being able to kind of talk to them just through a couple of fingers going from behind that ear right down your collarbone, that's a game changer. And it literally takes 30 seconds. You don't need an hour and a half yoga class. You can just do that sitting at your desk, or maybe you're stuck in traffic. One hand on the steering wheel, please, and the other hand does the massage. There's lots of ways to incorporate these types of techniques into your life in 30 seconds or less.
I love it. What an easy tweak, and that's so effective and works on so many levels. Yeah, so that one's great. You want to share another one?
Sure. I like to combine breathing techniques with stretching. So what we know about breathing is that it's a freeway to the calming nervous system. When you inhale, your heart rate goes up a little bit. And when you exhale, your heart rate goes down a little bit. So we can take advantage of that physiological phenomenon, and we can lengthen our exhales, right? So we're slowing our heart rate down just a little bit with a longer exhalation. So what I do, so going back to that cranial nerve 11 that feeds the upper traps and the sternocleidomastoid. So we're going to focus on the upper traps. That's a really easy muscle to stretch. You can just take your arm and bend the elbow and place it behind you. So it's kind of resting in the small of your back. And then so if your right arm is behind your back, you're going to tilt your right ear to your right shoulder. So now you're stretching the left upper trap muscle. Now, when you're there, you can do a breathing technique. And again, I don't think stretching needs to go full range of motion, right? I think I had mentioned before, you want to back off. You want to just do a little bit of a stretch. Just you start to feel a little bit of a pull. You're going to hold it there. And then you're going to take an inhale for 3 counts through your nose. And then exhale either through your nose or your mouth for 6 counts. So that's longer. The longer exhalation is what we want. And then exhale. So while you're holding that stretch and doing that relaxation breathing technique, you're talking to your nervous system. And you're saying to it, we're not in survival mode anymore. We're going to reset and turn off that switch, that alarm system that's broken, and we're going to relax. And you'll feel the upper traps relax, and you're going to feel the whole body relax. You know, you might get a signs of down regulation are going to be sort of an expansion in your body or a lightness in your body. You might feel like sighing or yawning. You might even get a tummy gurgle. Those are all signs that your body is responding to the technique. And I do encourage people to really pay attention to how they're feeling when they're using these techniques, because not everybody responds the same way. Some people actually get more anxious with breathing. It's rare, but it does happen. So I like to say that you know, put your detective cap on and see, like, what's going on in my body. Does my body like this technique? You can't always assume that the same technique that helps your best friend is going to help you.
It's so funny because when people have been, you know, there's a lot of people who have chronic stress and chronic just muscle tightness. And
Yeah.
they're like, oh my, you know, it's always that way. It's never. And then when they release it, they just feel so free. And it's something that they really haven't experienced because they just go through their life without, you know, in their head, not even realizing how tight everything is. So it's always such a good feeling, and to know that you can replicate this or continue doing practices to keep this good feeling. So it's just such a great situation. I love that. Is there anything else you want to share? Because I want you to talk about your book a little bit, how people go through the steps.
You know, from an osteoporosis point of view, I would just share that if you're feeling like your body is collapsing forward, that's something that's going to send a message of not so much fight or flight, but it sends a message of freeze, which is that part of the nervous system that feels very shut down. So you may not feel like you want to be social. You may feel like the world is against you. You're going to stay in bed and not get up in the morning. You know, there's this paralysis and hopelessness that comes along with that body posture. And what we have found is that turns off the abdominals. And we know now that the abdominals work in conjunction in the brain, working in conjunction with the adrenals where cortisol is produced. So working on your abdominals can be really helpful. Core work can be really helpful to kind of open you up a little bit and get you out of that freeze response. And I just wanted to let people know that, because with the osteoporosis, you can start to feel like maybe you're feeling like you're going into depression, and it could be that it's not a true depression, but it's actually your nervous system is going into a freeze state because of that rounding forward and that protective sort of stance. Yeah, that was one thing I wanted to add to what I was talking about.
You know, it's such a good point, because it's scary. It's scary if you're feeling, you know, if you start getting these feelings like what's going on. And also, there's nothing worse than feeling contracted. I talk about the two energies of contraction and expansion. It's just a horrible way to go through life, feeling contracted. So what I'd love you to do is just sort of share how people could use the book if they want to get started on this, because you have so many tools. It's really an incredible resource. So you want to just sort of explain how the progression goes?
Yeah, sure. The book is called Settled: How to Find Calm in a Stress-Inducing World. And the first whole part of the book is really about when and why you would use a settling tool. Because I really, excuse me, I really want people to understand that stress is not necessarily the bad guy. We need stress. Our bodies have evolved to require stress responses in emergencies. It just is that we get stuck in those stress responses, as I mentioned before. So I really talk about knowing when stress is helping you and when stress is harming you, and being able to harness it when it is helping you. And that's the first part of the book. And then the second part of the book is the first part of the book also gives you the anatomy of your nervous system and what that's going to look like, and knowing where you are in that nervous system state, so that you can figure out whether you are stressed or not. And then the second part of the book is really all the tools. And I have a chapter on breathing, a chapter on movement, on stretching. There's a chapter on using your senses. using touch and your vision and things like that. There's a chapter on eating, because I think a lot of people have very stressful relationships with food. And of course, when you are not in your parasympathetic, they call it the rest and digest system, your calming nervous system, for a reason. When you are not in rest and digest, that's going to be hard for you to take in food properly and digest it. So being in a regulated nervous system is going to be really important while you're eating. And then I have a couple of chapters. I do have a chapter on chronic pain. And I have a couple of chapters on connection and disconnection and how to improve our connections with others. And so, yeah, that's the book in a nutshell. It is really a guide on how to stress and what to do if you are in survival mode, and how to help yourself and not to feel shame about it, that this is not to be pathologized, that this is something that all of us go through. And we just haven't been given the right guidebook to get us to understand. We've all been taught that this top down, this brain down process of, think your way through it, talk yourself out of it, think positive thoughts. It works, but it works later on. I think if we can talk to our body first and foremost, then those techniques of mindset help later to kind of keep everything in check. And so we're kind of all beating ourselves up for being stressed when really we haven't been given the right tools. And so that's what the book is about.
Yeah, what I like that differentiates it from others is the physical tools, is dealing with the body. And I'm a big believer in all those mind things do work, but when we can add this piece to it, it's really a game changer. And I think if people are listening and they haven't been successful and they haven't, that this is going to just give them some great tools. But I love the two things to start with: stretching the traps and doing the scalene massage. I think everybody, and I'd love to hear how your neck pain, or how you feel. As you said, it may not be neck pain, but everybody, oh yeah, that muscle, it's so tight. I mean, I see that all the time. Everybody just thinks that's normal. So
yeah, absolutely. It is not just for people with neck pain. You can use those techniques to just talk to your nervous system in general.
Yeah. So how can people get in touch with you, or what are people's options if they want to further and work more in this area?
Sure. Thank you for asking. I have a company called Body Insight. And so if they go to my website, it's bodyinsight.com, and they can sign up for my newsletter there. And that way they'll know if I have workshops or book events coming up or whatever. If you're on Instagram or Facebook, I'm at Body Insight Inc. And I have lots of videos on different tools, different ways to think about stress. And I would love for people to follow me at either Instagram or Facebook. And of course, the book is available pretty much anywhere where you can get books online. And I hope everyone will check it out.
Oh, well, this has been so great. And I'm so glad that we connected, because as I said, when I saw your book and saw your work, I was like, oh my gosh, this is, again, you're looking at it through the lens that I look at it, that, as we said when we started the conversation, isn't typically done. And I just think you're adding such an important part to the equation. And I'm excited for everybody to try these techniques and just to know that there's more help. I'm a big believer in you dig deep, you figure it out, and it's not okay to live your life in stress. We're here one time, and we're in this lifetime, we're here one time. and we want to make the most of it. And feeling tight and feeling contracted and stressed out is just not the way to be. And so anyway, I'm glad you wrote the book. I think it's great, and I'm so glad we met, and I really look forward to staying in touch.
Absolutely. I'm really excited that we connected. Yeah, you're definitely my peeps.
This is so true. Well, any last minute things before we end?
No, I just hope people will get a lot out of what we discussed, and that there's so many more tools to share with you. So hopefully they'll check out the book and check out Instagram. I've got tools all over the place.
Oh, that's great. Well, thank you so much for joining me today.
Thank you, Margie.
I hope you enjoyed my interview with Chantal and now have a better understanding of how we can use some techniques that deal with the body to reduce stress and just be a win-win situation, both for our bones and overall health. The link to Chantal's book will be in the show notes, as well as the link to my Improve Your Bone Health Naturally mini course. So thank you so much for tuning in, and I look forward to seeing you on the next episode.